Have you ever found yourself wondering why the cost of your prescription medications seems to vary so much, even with Medicare coverage? It can certainly feel like a puzzle, especially when you are trying to make smart choices for your health and your budget. Well, a major part of that puzzle when it comes to prescription drugs is understanding Medicare Part D drug tiers. These tiers are essentially a classification system used by your Medicare Part D prescription drug plan to categorize medications, which directly impacts how much you pay out of pocket for them. Think of drug tiers as different levels in a pricing structure. Each Part D plan organizes the medications it covers into several tiers, typically ranging from 2 to 5 or even 6. Generally, the lower the tier number, the lower your out-of-pocket cost will be. For example, Tier 1 usually includes preferred generic drugs, which have the lowest copayments or coinsurance. Moving up to Tier 2, you might find non-preferred generics and some preferred brand-name drugs, and these will generally cost a bit more. Tier 3 often contains non-preferred brand-name medications, leading to a higher financial responsibility for you. Finally, the highest tiers, sometimes Tier 4 or Tier 5, are usually reserved for specialty drugs, which are often very expensive and can require significant coinsurance or a percentage of the total drug cost. It is crucial to remember that while the general structure is similar, each Medicare Part D plan has its own unique formulary, which is its list of covered drugs, and how it places specific medications into these tiers. So, what does this mean for you? The most important step is to review your chosen Part D plan's formulary. You will want to look up each of your prescribed medications to see which tier they fall into. This will give you a clear picture of your expected costs. It also allows you to compare different plans, seeing how they classify your specific drugs and what your copayment or coinsurance will be for each. A helpful insider tip is to be aware of concepts like formulary exceptions. If your doctor prescribes a drug that is not on your plan's formulary or is on a higher tier than a similar drug, you or your doctor can request an exception from your plan. Also, some plans use prior authorization or step therapy for certain drugs. Prior authorization means your doctor needs approval from the plan before you can fill a prescription, while step therapy means you must try a less expensive, often generic, drug first before the plan will cover a more costly alternative. By understanding these drug tiers and how they affect your costs, you gain valuable insight into managing your healthcare expenses. Knowing where your medications stand on the tier system empowers you to choose a Medicare Part D plan that best fits your prescription needs and your budget, helping you navigate your healthcare journey with confidence and clarity.